Hello everyone and welcome to Virtue Healthcare. Today we're going to be doing a guided rolling session around the knee to decrease muscle tension and improve joint health. But before we get down to the mat, let's get to the anatomy. And here we're looking at the anatomy of the knee. Today we're going to be looking at all the musculature crossing the knee for the purposes of our rolling session. We'll start off with quadriceps group, quad meaning 4. All culminating into the patella in an attachment through the patella tendon and ligament into the tibial tuberosity. We have vastus medialis on the medial or inside aspect of the leg, rectus femoris right down the center here, and vastus lateralis on the lateral aspect of the leg. Deep to rectus femoris, we have vastus intermedius. Moving along to the inside aspect of our knee, we're looking at sartorius, cool muscle wrapping around the leg onto the inside. Gracilis, a groin muscle attaching up into the pubic bone and then crossing the knee. And then a hamstring muscle in semitendinosus. All of those three culminating into an attachment right next to each other, often referred to as pezanserine or goose's foot. Another hamstring muscle, semimembranosus here, attaching just below the joint line onto the tibia. Going around to the lateral aspect, we have biceps femoris, long and short head, joining in their tendinous attachment into the fibular head here. Work all the way around to the most lateral. Everybody's favorite to talk about is the IT band, crossing the lateral aspect of the knee here, attaching into the tibia, up into our glutes and TFL and the hip bone. Let's move just below the knee to gastrocs, the most superficial lower leg muscle with its lateral and medial heads, both of which crossing the joint, the knee joint, and attaching onto the femur. Let's get rid of those and we'll look a little bit deeper to plantaris. Tiny little muscle crossing the joint line, attaching onto the femur here, and then all the way down into the foot. And then deepest to all those, popliteus, unlocks the knee, does some rotation. And those are all the muscles that we'll be working with today. I hope this is helpful. Now, let's get down to the mat and do some rolling self-care on our knee. Hey everyone, and welcome to the mat. We're going to get down on the mat here and we're going to work through muscles crossing the knee. This will be great for any rehab or self-care in between workout sessions or after activities to make sure that you can manage tension around the knee to decrease discomfort and increase mobility. So we're going to start with quadriceps group here. So grab your favorite roller because there is some thunder outside, and let's get down on the floor and let's get to rolling. So here we're coming down onto the ground and we're going to be working through our quadriceps as it's attaching into the top of the patella or kneecap here. So just get your foam roller or your ball just above your kneecap. And here I'm starting just on the inside vastus medialis attachment. And I'm just going to let myself sink in here, supporting myself as I need to. Let your head rest in your hand. And just gently move your body up so that you come into contact with the top of the patella there. And then just slowly work along here. I'm internally and externally rotating. Here I'm externally rotating to get a little bit more into vastus medialis. Now these muscles are extending the knee, so we can do a little bit of extension here and flexion. Actively moving while applying pressure will help speed up the process of decreasing tension in those muscles, in that tissue. And then just slowly work across the top. So here I start slowly internally rotating. This is just very slow, millimeter by millimeter, so it doesn't look like I'm moving that much, but muscle fibers are very small, so we want to move kind of muscle fiber by muscle fiber, feeling where were you kind of building tension more than others. And it takes time to decrease that tension, make that connection with the nervous system, and to have those muscles let go. So we want to give ourselves that time, listening to some quiet music, turning down your lights to decrease sympathetic nervous system response. This will help speed up the process as well. Help you relax. It's storming outside, so the rain's coming down. You might be able to hear that. But it's perfect time to be inside, taking care of yourself. And then we want to kind of get through all of those muscle attachments, those quadricep attachments at the top of the kneecap. So here I'm kind of getting through rectus femoris. I'm just kind of right on top of that kneecap in the very center. And feel free to switch legs after kind of each section, or do the whole leg, knee on one side, and then work on the other, depending on what you need for you. Maybe you're just working on an injured leg or recovering from something, and I would always recommend that you check in with the opposite leg as well, because you don't know how much compensation there might be there, especially if you keep on doing the activities that you do on a regular basis. We'll often lean on the other side a little bit more, so check in with that as well so you don't build too much tension there. And then we're into vastus lateralis here, so we're working into the outside lateral most muscle. Here I'm doing a lot of internal rotation to kind of get in there. Again, some slight extension and flexion at the knee. Gently breathing, bringing your mind into the area. What's the area telling you? Where is your tension? And with rolling, we're looking for an outcome. So we're looking for a decrease in muscular tension. So when you feel like you've kind of got through the whole area there, you can come up a little bit, do a little flexion extension, shake out the leg, See how that's feeling? And now we're gonna move around onto the inside and we're gonna work onto gracilis, sartorius, semitendinosus, semimembranosus, getting those groin muscles as they cross the leg into Pizzansarine, and hamstring muscles here. So let's work onto our side. Here, I'm getting into hamstring muscles, semimembranosus here. So just at the back of the knee, pretty much right just on the joint line here. And just crossing the knee onto the tibia, so just below it. This is going to do these hamstring muscles and the inside groin muscles are going to do some flexion of the knee and also some internal rotation. So we can extend and flex here very gently. Making sure that you're supporting yourself, you're not falling into your shoulders here. Bring a little bit of core tension to help support your core. So you're not just slouching on yourself here. Taking your time reaching with your heel as you extend. And then working. So I started right on the back there and now I'm internally rotating here. Getting into more semitendinosus and into those groin muscles, gracilis. As then I come around into that attachment here onto the tibia. And here I'm just gently internally rotating my leg and just letting that weight sink in. Some flexion and extension here. Breathing. Use your intuition to stop moving and sink into an area if you feel like it needs that. Or to do a little bit more movement in an area. Let's say maybe you stop, you sunk in, the feeling of tension sort of dissipates a bit, then maybe you could get into a little bit of moving and see if that brings up more in that area. And then I'm going to continue my internal rotation. You can block the ball, or you might need some space for the foam roller here if you're using a normal foam roller. And then there, check that out. Spend as much time as you need in these areas. And then we'll move into the lateral or outside aspect of our hamstrings here. Just above our joint line and moving down to the fibular head and that attachment of biceps femoris here. Both here on the back as well, we'll be getting through the gastroc muscles, the bellies, as they cross the tibia plateau, the knee joint from below and attach onto the femur. So a little bit of flexion and extension of the ankle will be helpful as well. And try some different movements. Try some rotation, try some extension and flexion of the knee, try some extension and flexion of the ankle. None of those are wrong, and just feel what you need for you. You're going to be using your body differently than I am, because we probably do different things. So what you need is going to be different than what I need. Even in our walking, we might walk slightly different. I might reach forward more, or you might extend further behind you to press off. And then just getting just below the joint line here, we're just in the top of gastrocs here. Some flexion and extension, you'll probably feel most likely. It's really coming down out there. It is a deluge, let me tell you. Calves are one of those postural muscles that holds a ton of tension, always holding us up. Oftentimes we lean a little bit more into our toes than into our heels when we're standing, walking. And it's one of those areas where you don't feel a lot of tension there, but it will build and you will notice it eventually. And so this will probably be a tender area for pretty much anyone getting into the area. Take your time working on the inside, the medial side, and also the lateral side. You'll definitely notice a difference, most likely, between the two, depending on how you move again. And then lastly, we're going to get into IT band, lateral attachments here across the knee. So just kind of feel that out. Keep working there if you need to. Pause the video anytime that you need. Coming on to your side. And you can lean back if you want. Lean back, relax. Feel free to work as far up the leg as you want as well. But please do focus on the attachments around the knee here. But you can follow these lines through quads, through IT band, all the way up into TFL, into glutes, or all the way up into the hip and the attachments there, or through those groin muscles all the way up into the ischial tuberosity, into the pubic ramus, the pubic bone. And then it's just a little bit of flexion and extension here. Try some rotation of the leg. Oh wow, that's spicy. Spicy meatball. And then relax. Working through the lateral quads. IT band area can be very intense sometimes. And here we're looking to work with the nervous system, so and then that crosses the knee and attaches into the tibia, so we can actually get across here onto the tibia. Here I'm just below and lateral or outside of my kneecap. And then check that out. See how it feels, and then go back and work on any areas that you might still be feeling tension, or you might need a little bit extra work. Thank you for joining me for this guided rolling session for the knee. If you liked it, please give it a thumbs up and feel free to share with any friends or family. Join the Virtue community by subscribing to the channel where we post weekly videos. If you'd like to work with us in person, feel free to check out our website, which we'll have linked in the description below. See you soon.